open, wide awake, not sleepy? Because I don't want to hear it. I didn't hear you say that. Okay. Okay. As far as for Ms. Miller's testing stuff, you guys should be familiar with the herpes zoster shingle stuff, and just know what, like, you know, the primary issue is with that, with the herpes simplex. And that's signs and symptoms. What are the sort of the main ones with herpes simplex? And as far, and the thing is, I wouldn't tell you to memorize all the symptoms, but you'll have to be able to look at this question, because I can look at the question, and there's some that you know is not it. So you have to, you know, rule those out, and then go to the ones that are the primary issues of that. Remember, primary issues of that. Remember the ABCD rule that she told you? Okay, and there's a like succession or you know how they start, right? They start maybe with the asymmetrical. And then they, you know, end with maybe, you know, increased diameter or something like that. But there's I'm sure there was a particular order that she gave you guys. So just remember that ABCD rule, and you should be able to get the question. Know what a patch test is? You know what they do for it? All that. Know your types of cancer, skin cancers. Skin cancers, know those. And you know, and how they're characterized, and what's the most common maybe, or the least common, or something like that, but you need to know, you know, how they appear. So you probably need to know the difference between maybe a squamous cell carcinoma and a basal cell carcinoma, something like that. Know what, let's see, causes tinea capitis, which is what? So, yep, here you go. And so you want to know, you know, what's the causative thing of that? What causes that? Know about the warts, and knowing and being able to think critically if you have warts on specific parts of the body, how does it affect that part of the body? You know what I'm saying? It could be a wart on your finger, which you know, interferes with you eating maybe, or something on your foot maybe interferes with maybe how you're standing, or you know, things like that. So just be aware of that. Know the difference between, let's see, herpes zoster and Ruka. I don't know if she went over that, but there's a skin disorder named that. You might want to take a look at it if it's not in your notes. Verruca, V-A-V-E-R-R-U-C-A. Remember that in your notes?
Yeah.
Okay, so just know about that, know about herpes zoster, be able to differentiate and stuff like that. Because I didn't know that one, so I couldn't help you with that. Eczema, know about eczema. Angioma. Well, not angioma, but know about that. Eczema, know what signs and symptoms of that is. And we all should know that we probably either had it or know somebody that had eczema. Know about signs and symptoms of impetigo, maybe. And psoriasis. No allergic reactions. You know, if you're stung by maybe a bee or something, you may have some life-threatening signs and symptoms. Know what they are. Because we talked about the swelling and everything. It's called a different term, but I'm not going to give you the term. You should know it, but everything swells up in your face and things like that. So. Know what the rule of 9 is. And I heard Ms. Miller saying, or asking you guys asking, were there anything on there where you have to know like what percentage of where it is? And so far with this question, it is not, but you'll need to know what the rule of 9 is and what it does cover or what it doesn't cover or whatever. So. And you know, because you know, if you know what the rule of 9 is, I'm not going to give a word because then you know what I'm talking about, but you know it has specific areas here and legs and blah blah blah. So okay, so but I'm thinking with this question you should get it. Know what infections you know, but any type of infection, you should know it. That's all I'm going to tell you, because with this question, if you know what infections end with and all this stuff, you should get the answer. You couldn't get it confused with something else, put it that way. I'm thinking that everybody will probably get that right.
Mm-hmm.
Especially my buddy. Okay, herpes zoster, know about that. You know that it's viral, right? It's a viral disease. And it follows like a certain sensory nerve pattern. Know about lupus, and in fact, hers, when she talked about it, which was skin, I also re-emphasized when I was doing musculoskeletal with your hallmark sign, right? What is it?
Butterfly rash.
Okay. So know about that. Know the definition of a purpura. Purpura. P-U-R-A. Purpura. There is a question that they talk about. This person has burns over 18% of her body. So you have to know, know about burns, know what exactly causes death when someone gets burned. What could be, what could they die from? Know about alopecia. And what causes it, or some of the causes of it. I think she went over that, and we talked about that. I remember her specifically going over that, and we talked about what could cause it, different things. Know about cold sores, again, caused by virus. Know what that is, which one. Know what happens if someone who is a diabetic and gets an infection. So with diabetes, their infections are different, so they may get some types of different infections over in their extremities and things like that, so you'd have to know about that. And know the signs and symptoms of those inflammations, or when someone has issues with their legs, especially with diabetes, know some of the complications of diabetes. Would you know anything dealing with circulation and all that stuff? Know about vitiligo, however you say it. What? Vitiligo, whatever. Potato. Okay.
What you say, what about it?
Yeah, know how it presents itself. I guess that's a better word. Know how it presents itself. Anybody have an issue with me saying that? Everybody knows what I mean? How it presents itself? Okay. Know the different lice, know what they're called, like lice of the feet, or the, abdomen or scalp, growing, especially for the tinea corporis. Know all of the lice, where they're at, and know the names of them, if they're in the head, whatever. Know the definition of a keloid. Know the phases of wound healing. And how I I do this, well, when I used to study for a test and I had to know things in sequence, and you know how they like to give you all, put this one first, and I always learned the first one and the last one, and I looked at that. That's a little cheat sheet. Know your airway stuff. That's all I gotta tell you. Know your airway stuff. There's a question related to that. Because it's gonna ask you as a nurse to critically think what are you looking for? What's your main concern with this resident that you're seeing? Know about hemorrhage, you know, if something changes, as a nurse, noting that anytime there's a change in something on your patient or resident, you need to know what to do, you know. Know about your circulatory, the checks, you know, the capillary refill stuff, all that. And know what it means. Capillary refill. Are you awake over there? Just checking. Okay. And again, know about wound healing. Know about, you know, which, you know, there's a question about wounds on here. So it's going to ask you, you know, to sort of, it's going to be asking you to say, is it normal healing or is it not normal healing? Put it that way. Who said that? You. Just read the question. Okay, I'm gonna read the question. I'm gonna put all kinds of words in it too. No, I'm not gonna read the question.
Yeah, like, okay, shut the doors.
Okay, no, of course, the cellulitis, necrotizing fasciitis. And the treatment, or you know, what causes that and what should be done about that. Because if you read the question, you should be able to pick out the answer. And did Ms. Miller talk about different healing intentions?
Yeah.
Okay, know that. Know that. Know that. And as a nurse, you should always observe what skin for their color, right? If okay, this question is going to ask you, like, what indicates maybe a healthy tissue as opposed to non-healthy tissue. You know, we're always asking you, and you should, you know, is their skin, you know, dry? Are there mucous membranes, you know, before the maybe pink or things like that? So you have to know that. Know about, let's see, pressure points. I'm sure she talked about that. Know the common areas for them. Okay. know what a wheal is?
What is?
Wheal, you know, like a wheal from like maybe allergic reaction or something like that. WHEAL. And you know, and again, when you look at these answers and you try to take the test, you know, sometimes the answer is right in there and you guys are searching for the wrong, you know. It'll say maybe acne. You know, what would it be described as acnea? You know, who's had acne? Is it sometimes that you have fluid in the pustules and all that stuff? So just know what the symptoms are of that. So know what that is. Skin needs to be assessed, you know, regularly. We know that, and during a bath. And we need to know if you know the proper technique in assessing skin. And you should, if anybody misses this question, I'm gonna get you, because you should know we've told you this enough that you will know. Put it that way.
Regarding dating?
Yes. And assessment of skin and all that stuff, what you need to do when you're assessing someone. Like again, you know how the skin appears in certain skin disorders, you know, like scabies and lice, you know, just know how they look, you know. With scabies, there's different distinctions, you know, of how it looks. And she talked about maybe the thread lines and stuff in scabies. It could be brownish or, you know, all that stuff. So, about that. And this one, you should get this one right, so I'm not gonna even go over that. You should know about tumors. No, if somebody, say, reports to, you know, like complain of maybe itching real bad and, you know, stuff like that, hands and arms. And then it's gonna give you a set of facts, and it's gonna have you to list what things you would ask the patient. You know, what would be, you know, sort of some of the most obvious things that you might ask if they're coming in here with itching skin and blah, blah, blah. And looking at this answer, I think you should get it. You know what neoplasms are? And we've already talked about lice, all of the different types of lices. Know what tumors can spread quickly, what skin tumors spread quickly. And I didn't say the most deadliest, so don't be confused. I just said which one spreads the fastest. Not the one that's the most deadliest. Then it's going to ask you to think about things, to critically think. You know, somebody asks you, you know, they got this and that. You know, as a nurse, what's your response going to be. So this is a response question. It's almost like a, something that you have to figure it out. You have to critically think what should be my response. A lot of times it's not what they ask you, it's what your response is
Response to what?
to a question that they ask. I'm not gonna tell you the question. Good try. Okay. Okay, just know about the herpes zoster, what that is, that's related to because there's sometimes you can get maybe chickenpox or something from different viruses, so you might want to know what that is, how you would, let's see, look at that. You want to look at your moles. She talked about moles. I'm sure Miss Miller did. So I don't know how many of them that you had but you need to know the contour of them. Which ones are flat, which ones are round, which ones are whatever. And for those, is there any matching? Yes, they are matching. Just came across some matching. Let me see. Hers is well, no, there's some matching on mine as well. So there's
about
altogether
10.
Though there's 1, 2, 3, 4, 5. 5 for her, and 1, 2, 3, 4 for me. So not a lot. Okay, let's see here. And I'm just looking at these. The ones that are here, I think you should get. The only one that I'll give you one, no, is Paronychia, Paronychia.
Spell that one more time.
Paronychia. So then the rest of them you should know. The rest of them that are on this page. You should know just by doing your assessments every day. You should know these. These are things that you should know. Now this is coming to my stuff. Just know what scoliosis is, and we've discussed that. Know what osteoarthritis is. Know the hallmark thing that I told you with that. I told you there's certain nodes. You need to know them. Know, people coming back from surgery and things, know about your assessment and what do you assess them for. If they're coming back for a leg, open reduction or something like that, what's your assessment? And I know everybody's gonna get this one, because I know you're not gonna be bamboozled. And cancer, know about, cancer. The warning signs, of course, but, things to prevent it, things like that. know how we talked about inspection and palpation and all that. You know what you do first, what you do second, and all that stuff. You know some of your definitions that I gave you. You know about orthopedic. You know what that is, musculoskeletal. You know, and I'm sure you should get this question as well. Know your procedures, your different bone procedures, scopes, you know, arthroscopes and all that. You should know this because today I'm not going to even go over this one because I told you this a couple times. I asked you guys today what that meant. So I'm not going to tell you again or you'll probably get the question. I'm not going to say, but you should get it if you were listening, because I think I asked a couple of different people what it meant, and you told me. You had the right answer, by the way, so you should be fine.
What was our answer?
What was the question?
You guys, wait a minute, let me see. Where's the spoon at?
Can we find it?
Let me find a spoon.
Me
And
the
some
spoon
food.
you love.
Give me some food. Okay. Someone know about someone that's in skeletal traction, and you know some of the things that you might report to the doctor or to the charge nurse or whoever is your superior if they're in skeletal. That's the traction. So you want to know what's like normal and what's not normal. And with this, you're going to have to critically think, look at these answers, and then say, which one? One of these is telling me far something different than anything else because of what it says there. So no signs of, I'll give you a clue, no signs of infection. I can tell you that.
That sounds good.
We talked about the EMGs and all that stuff, so you know what they are. Gout. What's the pathophysiology of gout? We talked about that, I remember. Uric acid, I gave you guys some levels and some for calciums and all that stuff. And it's in your notes. You might want to take a look at that. Know your normal ESR rate, maybe. This is a long question that you're going to have to think through, so this is just, you're going to have to know from the type of fracture that this person sustained, which is a compound fracture, you know, of the femur, which is the big bone. Then you're going to have to know what complications that they can have with that type of fracture. Because it's a compound fracture. It's dealing with, you know, like the arteries and veins and all that stuff. So you have to really know what can happen. Remember we talked about cast care, right? We talked about the cast, what you know, if there's a cast on, what you look for, compartmental syndrome, things like that. You wanna, you know, so we need to know that you know what to report to a doctor or charge nurse if the patient is complaining of certain things. And I'm sure you should know this. But don't get sidetracked with, because when reading this, someone saying, they're getting this, let me go get this. But read it carefully. Know about fat embolus and what it does, and we talked about that. What are some of the complications of fat embolus? You know, and how do you care for someone with a fat embolus? Know the different lab values for lupus. And if this question, if you know the most important ones for lupus, then you should get this question right, because everything else on here is stupid. And how do you confirm rheumatoid arthritis? They're going to give you some different answers, and the answer that you choose will tell me if you know the signs and symptoms of rheumatoid arthritis and the pathophysiology of it. And we already talked about you guys knowing what the normal levels are, calcium and all this stuff. Know about osteomyelitis, what it is. Just with that term, you should get the answer and know what it is. Then this next question is, you know, it's just.
Good afternoon, everyone. Please excuse this brief announcement. This weekend, Johnson students competed in the Skills USA regional competition in Ashtabula. 12 of our students came home with medals. Javon Lane won a gold medal for the second straight year in a row in medical terminology. She is a student in Ms. Perry's Allied Health program. Mr. Single's instruction class got a silver medal in teamwork, and that team consisted of Christian Perez Lopez, Marshall Heron, Anthony Ferguson Cruz, and Reynaldo Torres. Mrs. Olenik's public safety class competed in the crime scene investigation competition and received a silver medal also. That group consisted of Ashley Penna, Nevaeh Neal, and Dakota Lloyd. Also receiving silver medals were from Mrs. Durani's class in the promotional bulletin board competition, and that team consisted of Latea Walden, Sashima Jennings, and Liberty Littlejoe. Also from Mrs. Durani's class competing in the job skill demonstration open competition was Kaylee Gentles, and he received a bronze medal. Congrats to all of our students who competed in the 2020 Skills USA competition.
Okay. This next question is a critical thinking question. Talks about, you know, someone comes in the office complaining of blah, blah, blah. And the next question, sorry about that. If someone would come into your office, you know, complaining of a skin rash maybe, and then is asking you what's your next question to them, what would you ask? someone has a fractured tibia and fibula, and they want to know, how do you assess circulation? Don't get confused with this one, because there's two things that could be right, but the one that's more definite would tell you, oh yeah, the blood's moving. Okay, next one. Know what causes osteoarthritis? And looking at these, you should get it, because like I said, the rest of them, if you know what osteoarthritis is, you should get the answer. You know that it involves the cartilage and all that stuff within the joints. Know signs and symptoms of course, osteoarthritis, ankylosing spondylitis. And you have to be careful, because you could get, in this one, there's a lot of itises, so you have to really sort of be specific and know where the inflammation is, and if the disease is more of a, what, type, how is it characterized, and if it's a sudden disease, or is it chronic or something like that. So you might want to make sure you look at that. And the key to this, if you got the answer, is if you read the question, because the question is going to tell you if you know really what ankylosing spondylitis is, or if you know what rheumatoid, if you know like I said, the pathophysiology. And there's a response question, somebody diagnosed with gout, and they asked the nurse to explain about the cause, and what would your response be? You have to look at the ones and see which ones is more critically thinking that you might want to say. Know about carpal tunnel? Know about gout? The signs and symptoms? Know the degrees of burns, know about first degree, second degree, third degree burns, and which layers of the skin they affect. Define dyskinesia. 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 Again, know about fat embolus. There's another question about that. You want to know about the scoliosis, lordosis, all that. Know the nodiosis. Define scoliosis, all that. Your definitions, there's a lot of them on that paper I gave you. osteomalacia, and there's a lot of them. This one is going back. It's nothing that I've talked about, but you need to like scan your memory about injections. You know, and you know the different sites for adults as opposed to maybe infants. You know, which sites are better, things like that. Know what osteoarthritis is. And there's a key word that I've talked about, you know, when I did that lecture that you guys, I'm sure you picked up on it. Know about compartment syndrome? That's with the cast. Some of the complications, you know, what you assess. So signs and symptoms of compartment syndrome is in order. There's another fat embryo. There's about 3 questions on that. So you gotta be really keen on that. What are some of the warning signs of cancer? And you should get this one, or you don't know them all. And then, of course, osteoporosis, know the definition, what it is. Know how rheumatoid arthritis is characterized. I talked about that. Right, and you guys do know what the terms exacerbation means, right? You know what that means? We'll find out what it means.
Can you spell it for us, please?
EXACERBATIONS. I know you guys know what that means. Anybody that has cancer can be in what? Remission or exacerbation. Where remission, they're getting better. Exacerbation, they're getting worse.
So it's getting worse.
Define a comminuted fracture. A comminuted fracture. Comminuted fracture. Just know about the fractures, but you know about that. And know what what the adduction is and abduction and all that terminology.
Abducted like it.
Know what tests they do for lumbar issues or herniated disc or things like that. Issues involving the spine. And then as far as your matching, and there are some matching. 4 of them.
Only 4?
Yeah, it's only 4. You should get.
Like A,
You
B,
should know
C, D.
these. You should get them. Because you guys all know what ankylosis is, right? So I'm just going to give you a clue. Okay, so that's that. That's the. I gave you the test in almost entirety,
And now
without
we
the
can
exception of some of the the things, yeah, the critical thinking things that you should do. So I'm hoping everybody does well on it.
Maybe 50-50 for the questions.
Hmm?
Say the test about 50-50 for the questions.
About 50-50, yeah. Hmm? No. That's not it. So you have to know the pathophysiology. What causes it, or what is it? What is that condition? Okay, you guys, use it. Maybe.